In 2023, dialysis patients can follow Renal diet, which focuses on maintaining kidney health and managing the dietary needs of individuals undergoing dialysis treatment. The Renal diet aims to reduce the burden on the kidneys by controlling the intake of certain nutrients, such as sodium, potassium, phosphorus, and fluids. Here are some key guidelines for what dialysis patients can eat. Low-sodium foods. To manage blood pressure and fluid balance, it is important to choose low-sodium options. This includes avoiding processed and canned foods, as they often contain high amounts of sodium. Opt for fresh fruits, vegetables, and lean proteins prepared with minimal salt. Limited potassium intake. Dialysis patients need to regulate their potassium levels. Foods high in potassium, such as bananas, oranges, potatoes, tomatoes, and avocados, should be consumed in moderation. Instead, incorporate low-potassium alternatives like apples, berries, green beans, and cabbage. Phosphorus control. Since the kidneys have difficulty filtering phosphorus, dialysis patients need to limit phosphorus-rich foods. This includes dairy products, nuts, seeds, and certain meats. Instead, opt for low-phosphorus alternatives like rice milk, cauliflower, white bread, and lean cuts of meat. Fluid restriction. Depending on individual needs, dialysis patients may have to limit their fluid intake to prevent fluid buildup. This means avoiding excessive consumption of water, juices, sodas, and other beverages. Opt for smaller, more frequent sips throughout the day and monitor fluid balance closely. Protein management. Protein is essential for dialysis patients, but it's important to balance intake. High-quality protein sources such as lean meats, fish, poultry, eggs, and dairy products are recommended. Consult with a dietitian to determine the appropriate amount of protein based on your individual needs. Remember, it's crucial for dialysis patients to work closely with their healthcare team and a registered dietitian who specializes in renal nutrition. They can provide personalized dietary recommendations tailored to your specific needs and help you maintain optimal kidney health.